should you decide not to receive it, it will not change your standard medical care. If it will not change your standard medical care, then how is it that hospitals are trying to fire or coerce or encourage healthcare workers to terminate their position?
You are a natural born public speaker, and that's a fact.
Do you actually feel guilty, or were you just told to feel guilty?
Focus on actually what we can do.
Point it out and show it to me.
You have the freedom to do what you want to and be what you want to in America.
What are we going to do about it?
What oppressed me?
Just saying.
So the CRT stuff, BS.
So I did a video a while ago with the COVID-19, the information that was given to medical professionals across the board. And just so happened, we just happened to get another packet of information that came in a few days ago that you guys were asking me about in regards to it for healthcare providers and for recipients as well, caregivers and recipients, or healthcare providers and those that may be administering the COVID-19 vaccination. So with that being said, I just want to show you guys that this is what was given to us as a packet. And as you can see in the bottom right there, let me see if it can focus in. Come on, focus in, camera. Come on, I know you're better than that. Revise. See that? August 12th, 2021. I just want to point out a few things to you folks. This is coming from the Pfizer, which is what our particular one of the facilities of many decided to go with. Okay. And first of all, let me just tell you that it says right here, the FDA has issued a emergency use authorization, or a EUA, to permit the emergency use of the unapproved product Pfizer Biontech COVID-19 vaccine for active immunization to prevent COVID-19 in individuals 12 years of age and older. Okay, so pretty much as a lot of these sheets that we have right here, if you are someone that's administering, it's just pretty much telling you how to administer it, you know, what temperature it should be, yada, yada, peanut butter. But I'm not going to bore you guys with all that facts like that, because they gave it to a lot of people that actually provide certain types of care, and they didn't know who was going to be doing and administrating the vaccine or not. So I'm going to skip ahead to a few pages that I highlighted myself. So one of the first thing that pops out right here is it says, warnings. Individual with known history of severe allergic reaction, anaphylaxis to any component of the Pfizer Biontech vaccine should consult a physician or not take the vaccine. Okay. Also, reports of myocarditis or pericarditis. Reports of adverse events following the use of Pfizer Biontech COVID-19 vaccine under the EUA suggest increased risk of myocarditis or pericarditis. That means inflammation of the heart, or the pericarditis is the inflammation surrounding the heart. So usually you got like fluid that surrounds the heart. Your heart is surrounded by like a fluid sac. And anyway, it causes the inflammation of that. No different than like how meningitis is. You get meningitis, that's inflammation of the meninges. The meninges is the covering of the brain. Okay. So anyway, that's what I want to point out right there. That's been the biggest thing right there. Then also right here, you see I have it all highlighted for you guys. So this is off of Pfizer themselves, package that they've given us. It says altered immunocompetence. Immunocompromised persons, individuals receiving immunosuppressant therapy may have a diminished immune response to the Pfizer. Okay. Pfizer Biontech COVID-19 vaccine may not protect all vaccine recipients. So for the ones that said, I can't believe I got the doses, yada, yada, peanut butter. How did I get COVID-19 after I've gotten the vaccination? Well, right here, because I read this before months ago when they was first introducing this. It says that the COVID-19 vaccine may not protect all vaccine recipients. So if you got COVID after that, it didn't protect you pretty much. And if you didn't get COVID after that, it doesn't necessarily mean that it did protect you. Well, wait a minute. Yes, it does, because if I had it, we're going to just wait. I'll get to that. There is no information on the co-administration of the Pfizer BioNTech COVID-19 vaccine with other vaccines. Now, listen, it didn't say with other COVID-19 vaccines. It says there is no information on the co-administration of the Pfizer COVID-19 vaccine with other vaccines. So you may have just recently gotten, I don't know, other booster shots. You may have recently gotten, I don't know, any type of shot in regards to vaccines. And they're saying they don't know what the adverse effects would be if you took it with other vaccines. All right. Information to provide to vaccine recipients, caregivers. This says you must, as a caregiver or vaccination provider, you must communicate to the recipient or their caregiver information consistent with the fact sheet for recipients and caregivers. FDA has authorized the emergency use of the Pfizer COVID-19 vaccine, which is not an FDA approved vaccine. They keep on emphasizing that. The recipient or their caregiver has the option to accept or refuse Pfizer 19 vaccine. This was updated as of August the 12th. The significant known and potential risk and benefits of the Pfizer COVID-19 vaccine and the extent to which such risk and benefits are unknown. So, did y'all catch that? The significant known potential risk and benefits and the extent to which such risk and benefits are unknown. This was updated August 12th. I showed y'all at the bottom. And on this page that I'm reading to you guys right here, just so people don't think I'm lying about it, it's right there again. Revised August 12th. So the vaccination that some people may have gotten is telling you the benefits or the risk are unknown besides the pericarditis and the myocarditis, right? So also let's read on. This says mandatory requirements for Pfizer Biontech vaccine administration under emergency use authorization or EUA. In order to mitigate the risk of using the unapproved product, look how they keep throwing it in there. In order to mitigate the risk of using the unapproved product under EUA and to optimize the potential benefit of Pfizer Biontech vaccine, the following items are required. Use of unapproved COVID-19 vaccine for active immunization to prevent COVID under the EUA is limited to the following. Here's one. Vaccine is authorized for use in individuals 12 years of age or older. The vaccination provider must communicate to the individual receiving the vaccine or their caregiver information consistent with the fact sheet for recipient and caregivers. Why they want them to refer them to the fact sheet. This says the vaccination provider must also include vaccination information in the state/local jurisdiction immunization information system, or the IIS. Okay. Now, what I want to point y'all attention to something in this packet is that it says right here, the vaccination provider is responsible for responding to FDA requests for information about vaccine administration errors or adverse effects or adverse events, cases of MIS in adults and children, and cases of COVID-19 that result in hospitalization or death following administration. So what I want y'all to think about here, it says the vaccination provider is responsible for responding to FDA requests. So let's just say if you did have an adverse effect, or somebody might have died, fainted, passed out, any of the issues that may come with taking the vaccination, it says the vaccination provider is responsible for responding to the FDA request. But what if the FDA don't request it? It didn't say that if these things happen to them, that they must report it to the FDA immediately or in a certain period of time. It doesn't say that. It says that if something like that happened to anyone that's taking this vaccination, when it comes in regards to Pfizer, it says that the FDA has to request it. That's what it says. The vaccination provider is responsible for responding to the FDA request. But what if they don't request it? Anyway, just want to throw that out there, which here it is. The serious adverse events or effects is defined as, number one, it says death. Life-threatening adverse event, inpatient hospitalization or prolongation of existing hospitalization, a persistent or significant incapacity of substantial disruption of the ability to conduct normal life functions, a congenital abnormality, a birth defect, an important medical event that based on appropriate medical judgment may be jeopardized to the individual and may require medical or surgical intervention to prevent one of the outcomes listed above. Taking the vaccination and something may happen to you that requires you to have surgery in order for having to possibly have to prevent you from dying. So possibly blood clots. It could be anything, bleeding out, some type of injury to certain internal organs, whatever the case may be. If it's a result of vaccination, I just named off all those adverse effects or adverse events if you happen to get those after vaccination. But at the same time, go back to what I said earlier, because the main topic here says the vaccination provider is responsible for responding to FDA requests for any of these things that may happen. Don't mean that they're going to actually just give it to them if the FDA is not asking. Okay. So a lot of other stuff is still in here about it's just showing you pictures of how it's administered, what temperature that needs to be at. You can look that up yourself. I'm just kind of hitting on some main points right here. I think that's important to you, the listeners. Okay. One that says available alternatives. There is no approved alternative vaccine to prevent COVID-19, although they're saying that this is not a proven one either. There may be clinical trials or availability under the EUA. This vaccine is being made available for emergency use exclusively through the CDC COVID-19 vaccination program. Healthcare providers must enroll as providers in the program and comply with the provider's requirements, right? So it's saying, I guess, healthcare providers have to enroll in this in order to provide this and for them to actually be able to disperse this for free. But the question to that is, do healthcare providers have to enroll in it? So it's just like saying, if you want to get these vaccines to some of your patients, you must enroll in our program to administer this vaccination. But do these healthcare facilities have to enroll in them? Why do they choose to enroll in them? How can it be an option that if anybody wants the vaccination, that they have centers that these people can go to get the vaccinations themselves? You know what I'm saying? So if a certain company did not enroll in the free vaccination administration program, then would the company necessarily have to try to press for their employers to get vaccinated? Just a question to throw out there. Okay, so let's see. Authority for issuance of the EUA. This says, although limited scientific information is available, based on the totality of the scientific evidence available to date, it is reasonable to believe that the Pfizer Biontech COVID-19 vaccine may be effective. It said may be effective. It didn't say is effective. It said may be. Okay. And let me take y'all to some more visuals of some more visuals here. Okay, so just bear with me here. I'm just trying to get to some major pages some things that I highlighted. I just pretty much thought that you, the listeners, might be interested in. That was my interest right there, the ingredients. Okay, here's one right here. As of August 12th, 2021, has the Pfizer Biontech COVID-19 vaccine been used before? This says the Pfizer Biontech COVID-19 vaccine is an unapproved vaccine. In clinical trials, approximately 23,000 individuals 12 years age and older have received at least one dose of the vaccine. Did y'all hear that? Did y'all catch that? What do you mean, did you catch that? The question darkened right here. See that? To let you know I'm not lying to you. I'm not making this up. This is from Pfizer, what they gave to healthcare professionals. This says, has the Pfizer Biontech COVID-19 vaccine been used before? It didn't say yes. It didn't say no. This says the Pfizer Biontech COVID-19 vaccine is an unapproved vaccine. In clinical trials, approximately 23,000 individuals 12 years of age or older have received at least one dose of the COVID-19 vaccine. I don't understand how that is right as of August the 12th when so you telling me only 23,000 individuals 12 years of age or older have received it, but I guess this is a clinical trial. But for other folks that have taken this in these certain facilities, are we not getting data back on them? Just something to think about, guys. Okay. What are the benefits of the Pfizer Biontech COVID-19 vaccine? This says in an ongoing clinical trial, the vaccine has been shown to prevent COVID-19 following 2 doses given 3 weeks apart. The duration of protection against COVID-19 is currently unknown. What are the benefits? You do remember earlier, and this paper that I'm reading from right now, that paper is in regards to you, the recipient, right? But I read something earlier that seemed to kind of contradict that, and I might be wrong with that, but I thought I read something earlier. The Food and Drug Administration has issued emergency use of to permit emergency use of unapproved product for active immunization to prevent COVID-19. Okay. So I thought I read something earlier where it says, anyway, I don't know where I went with that, but I thought I read something earlier where it's saying that it does not show that it actually has no data to say that they can prove that it actually showed that it did prevent something. Let's see. So anyway, as I'm saying this right now, I'm pretty sure a lot of you guys are in the live chat. just chatting it up as I try to find that part right there. Pfizer BioNTech. Okay, there we go. It says limitation of effectiveness. Pfizer BioNTech COVID-19 vaccine may not protect all vaccine recipients. I think I talked about that earlier. Okay. The significant known and potential risk and benefits of the COVID-19 vaccine and the extent to which such risk and benefits are unknown. But then it turns around right here and says, in an ongoing clinical trial, vaccine has been shown to prevent COVID-19. Okay, in the clinical trial, it's been shown to prevent COVID-19. How do we know? Example, if I'm not vaccinated, I'll give you an example. If I am not vaccinated, what can we say? Because the fact that I have not gotten COVID-19, what can we say that I've been doing or have done to prevent me from getting COVID-19? Don't say the mask, because it's definitely not the mask, because there's people I know that wore masks and still end up getting COVID. Some shape, form, or fashion. A missed hand was washed, droplets was on something, it entered in through their mouth, whatever the case may be. But my point is that when I just read right here that it said the significant known and potential risk and benefits are unknown, but then it turns around right here, says the unapproved vaccine, which was given by Pfizer, Biontech COVID-19 vaccine has been shown to prevent COVID-19 following 2 doses. My question is, how do they know? How do they know that did COVID attack the system? You know what I'm trying to say? These are details that I want to know. When these people who got the COVID-19 vaccination, what happened to them that they actually turned themselves in? And then for them people to say, well, guess what? It's preventing you from getting it, because guess what? I have not gotten it. So what prevented me? Don't just say, oh, I already said, don't just say the mask, whatever like that, because I've gone out in population. I've hugged necks. I shook plenty of hands at church speaking events that I've done up to this day. Shaking hands, no mask, hugging people. I have not gotten it. You know what I mean? So what if I was to say what I'm doing, what I've been eating, what I've been drinking has prevented me from getting it? You would say, oh, that's not, no. So why can't I be classified, and a lot of people that's like-minded, why can't we be classified as a scientific study? How come we can't be in hypothesis when the unvaccinated didn't get anything during the whole pandemic, and yet we remain healthy? You know, would you want to know what I was eating? Would you want to know what I was drinking? Would you want to know what preventative measures I was taking? Right? You would want to know that, right? Because you would want to say, this guy right here, we've been watching him on YouTube since the day that it hit. We've been watching Ty on YouTube since the day that it happened. Matter of fact, do y'all remember the cookie? Let me go get the cookie. All right, so check this out. I know I paused for a second. You guys were with me over a year ago. I told you guys how COVID was starting to go around in February in 2020. And look at this. Remember this? I put this in a Ziploc bag. Look at that. 4/23/20. And I called it the Corona cookie. And you guys remember I told you I was going to freeze it. Then I was going to freeze it and keep it frozen until after this stuff was over with. And look at here. There it is, folks. Remember that? I have to reflect back to that video. There is the cookie right there. Just threw that in there. Just to let y'all know that that's how long we've been dealing with it. And this what was given out to the facility. See, they was giving us these nice little cookies and all that when we were heroes, because we were going and risking our lives every day. Remember that? So anyway, back to what I was saying. When it said, what are the benefits of the Pfizer, the Biontech COVID-19 vaccine, it says the duration and protection against COVID-19 is currently unknown. Well, I would say yes and no, that it is currently known. And the reason why I would say it was currently known, because I guess some people did get, we have patients that have gotten COVID-19 again, not the variant. They tested positive for the COVID-19 because there is no test for the variant. Anyway, with that being said, let me move on. What are the risks of the Pfizer BioNTech COVID-19 vaccine? This says signs of severe allergic reaction can include difficulty breathing, swelling in your face and throat, fast heartbeat, which is tachycardia, a bad rash all over your body, dizziness, weakness, myocarditis, which is the inflammation that I told y'all is inflammation of the heart muscles, or the inflammation surrounding the lining of the heart muscle, the lining of the pericardium, and also chest pain, shortness of breath, heart fluctuations, palpitations, pounding of the heart, murmurs. Okay. Severe allergic reactions, non-severe allergic reactions such as a rash, itching, hives, swelling to the face, myocarditis, pericarditis again, injection site pain, tiredness, headache, muscle ache, chills, pain, joint pain, fever, injection site swelling, injection site redness, nausea, feeling unwell, swollen lymph nodes, diarrhea, vomiting, arm pain. These may not all be possible side effects. Serious and unexpected side effects may occur, though. This says, what should I do about side effects? It says, call 911. No, it says, what should I do about side effects? It says, if you experience a severe allergic reaction, it does say call 911 or go to the hospital. And last but not least is what I want to read off to you guys. Wait a minute. It's two different things here. As of August, okay, I'm showing the paper so you two don't try to give me, they try to get you for misinformation. See that? Revised, August 12th, 2021. It says right there at the top, ladies and gentlemen, what if I decide not to get the Pfizer Biontech COVID-19 vaccine? It says right there, it is your choice to receive or not receive the Pfizer Biontech COVID-19 vaccine. Should you decide not to receive it, it will not change your standard medical care. If it will not change your standard medical care, then how is it that hospitals are trying to fire or coerce or encourage healthcare workers to terminate their position? How is that? When the makers of the vaccine got it authorized as an emergency use authorization, but then the makers of the vaccines are saying to the ones they are providing the vaccine for, should you decide not to receive it, it will not change your standard of medical care. So how are hospitals able to do this with employers? There is no U.S. Food and Drug Administration approved vaccine to prevent COVID-19. Again, for YouTube and fact checking, see this right here? This is a fact sheet for recipients and caregivers, okay? There is no U.S. Food and Drug Administration approved vaccine to prevent COVID-19. It is your choice to receive the COVID-19 vaccine, is what it says. There you are, ladies and gentlemen, for the ones that have been wondering about this. I read it off. I have a thick sheet paper right here that they've given to us for healthcare providers, and he also gave us the ones for the recipients. And I just read it off to you. So it's confusing because one minute to say it did say it may help prevent it, but then you just got done reading right there. It said there is no approved one that actually may help prevent COVID-19. There is no approved vaccine. Question then will be, how are they able to get away with this? Are they, what is it that's in the policy? You performed your job all these years. You gave yourself all these years to this company. And for them to turn around and betray you by trying to force you to get some, there is numerous of things in the hospital right now or in certain facilities that are not forced. Why is this one thing forced? We've already done our talk about the mask and their efficacy when it comes to them actually really preventing you from getting it. Some people try to say, well, the reason why you didn't get it is because of the mask. I'm like, okay, I get that. When I go into a room with somebody that actually does have COVID-19, I wear the mask. I will wear a shield because I have more of a chance of their spit particles getting on the shield. And I definitely know it's not going through versus if some of those microscopic spit particles get on the mask. But point in saying that, the patient would have a mask on and I would have a mask on. But as far as going out in the public, or like on one of my jobs, I walked down the hallway on one of my jobs. Nobody was in the hallway. And I ran into one of the director of nurses. She said, Ty, where's your mask? I put it up. I said, it's right in my hand. She said, why don't you have it on? I was, for who and for what? I'm walking down the hallway where no one is. Why do I need to have this mask on? Now, again, I go back to the other hospital facilities that I worked in that they know I don't take the flu vaccine. They respect that. But they just tell me, well, since you're not taking the flu vaccine, Ty, when flu season come around from November all the way to, I think they ran from November to January into February. They said, when you come within 6 feet of a patient, can you put a mask on during flu season? Okay, got y'all. Why is this any different? Well, because it's more contagious. More contagious does not mean more dangerous or more lethal, period. Anyway, folks, Let me know what y'all think. I read that off to you guys. Y'all have any questions or anything, make sure you put them in the comments below. Do not forget that if you want to subscribe to the channel, make sure you get an idea of what my whole channel is about. Don't just look at reaction videos. Don't just look at these videos I've been doing thus far. Go to my channel. Look on my channel. Click on the word playlist. Look at all the things I do on my channel. Get an idea of who I am and what this channel is about before you subscribe to it, all right? And as always, if you would like to donate to the channel, that's how you can do it right there. Do PayPal me. If you want to join Patreon, that's how you can do it. If you donate, great. If you join Patreon, great. If you don't donate, great. If you join Patreon, great. If you would like to send any type of literature, books, gifts, yada, yada, peanut butter, that's how you can do it, by sending it to that address right there, okay? Again, leave y'all comments in below and let me know what y'all think. I am Ty Smith, modern Renaissance man, hoping and praying that every last one of you have food, shelter, and clothing, and most of all, I hope and pray every last one of you guys are in great health. God bless you all through Jesus. What is going on, folks? Appreciate you guys watching. Do me a favor, if you're trying to get to the next reaction video that I did after this video, it's right here. But if you're trying to get to my own personal stuff where I do a lot of comedy things that make you laugh, can help brighten your day, then you click right here, all right? And if you want to subscribe to this channel, you forgot to get to know who I am first, all right? Then you're going to click right here to lead you into this subscription. Make sure you hit the bell notifications to get notified anytime I post a video, all right? Peace.